Whew, what a beautiful day. I'm just finishing up the chores outside and I am getting ready to go in and get a nice hot cup of coffee. And I wanted to sit down with you and go over some information that I would like to share about newborn babies, postpartum, and some tips that I have. So come on, let's go. Whether it be you personally or whether it be someone, a friend or family member that you can pass this information on to, this is just some things, some tried and true tips that I'd like to be able to pass on. But first, I am enjoying a few moments with a fresh cup of coffee. If any of you have many children or lots of responsibilities, you know that getting a nice hot cup of coffee is a very rare thing. So I'll at least savor a first few sips of this while it's still hot. And I realize as I'm sitting in front of this camera that I am quite smeared with baby boogers. So we're gonna do the mom thing and cover that up. It's not wet, so it won't get in my hair. Okay, so I've been writing some things down over the past 2 months, and I want to be able to share them with you. Okay, these are in no particular order, just basically what came to mind, and I just wrote them down. So I'm just going to share them in the order that they came to mind. Number 1 is save your maternity clothes for after you have the baby. Because as much as you want to and as much as we may try, you will not be fitting into your pre-pregnancy clothes so soon after having the baby. Now, I guess there might be a couple of you that are able to slim right down. However, it should not be something that we need to be pressured into doing. We shouldn't be pressured into fitting back into our pre-pregnancy clothes, because for most of us, we've gained some weight. And for the first few months after having your baby, your weight should not be on your mind at all. And believe me, I am one to speak because I do fret a little bit about my weight and just wanting to make sure that I don't let it get out of control. But even I still give myself several months after the baby before trying to fit into pre-pregnancy clothes, before trying to look any certain way. After I've had several months of getting established with my new baby, then I will start focusing on how I can lose a little bit of weight. That doesn't mean, however, that you shouldn't be careful with what you eat and you shouldn't still be focusing on high protein foods. So keep that in mind. As far as keeping maternity clothes, right now I'm wearing a sweatshirt or shirt that is a maternity shirt. And sure, it might be a little baggy on me, but that's okay. I can comfortably fit into it. Tip number 2, my baby sleeps in bed with me. Now, I know that can be a little controversial because I know that there have been some very unfortunate situations where things have not turned out well. However, me personally, I find that it is a lot easier and a lot better for baby and I to sleep with each other. Now, I do have a pack and play that has a little bassinet attachment to it. It sits on top of the pack and play, and I will use that for my baby if for some reason he needs to sleep outside of my bed. But I always, for the first couple months, have the baby sleep in bed with me for 2 reasons. First, because I like to have that closeness with my baby. Now, it could be maybe heavy instincts that are kicking in from me having the miscarriages, and I feel like I have this baby, and after wanting children for so long, I'm just savoring it. This baby is on me all the time. It could be partially that, but I naturally desire, my mama instincts desire to have that baby close to me. So that is the first reason why the baby sleeps with me. And the second reason is because it makes sleeping happen. It makes sleeping possible. When I nurse the baby, I stick the little baby right up against my breast, right underneath my arm, and the baby nurses, and then we both fall asleep. And then when I wake up a few hours later, the baby wakes me up a few hours later, I put the baby over on the other side and nurse on this side, and then we just go back and forth all night long. Now, You may be concerned that I might roll over on the baby, and I understand that that can be a concern. However, I do have a little makeshift bed that I make for the baby where I take a blanket and fold it and roll the edges up, and I stuff that in a pillowcase. So this pillowcase has a blanket with edges on it, essentially. It's like a little mini bed mat, I don't know, and it keeps the baby from rolling. So my biggest concern is not me rolling over onto the baby, just because I have some different pillows and my legs are in place to prop myself up comfortably to nurse. But it's that the baby's gonna roll down onto me since I'm weighing the bed heavier. I don't want that baby to roll down onto me. So by me creating this little bed with blankets rolled, and it's not anything that the baby's gonna suffocate in. Like I'm not talking like a big thick blanket. I'm talking, you can take a towel and just roll the edges of the towel up just to create kind of a firm little ledge to prevent the baby from rolling towards you. That has worked for me for multiple babies. And I've even had the little bed inserts that you put in. It's like an actual bed for the baby. And that was great, but I found that it just wasn't what worked for me. I wanted to be able to nurse and fall asleep with that baby. So the other thing is, as everybody says, sleep when the baby is sleeping. And that is very true if you can, and really, really try to allow yourself to sleep with the baby. I tried as much as I could during the beginning first week or two, but now that things are kind of getting a little bit more active, I want to be up and getting things done. So I take that advice in the very beginning, but Lord knows we all need to get back to our houses and get back to things. My next piece of advice is to not change your noise level just because there's a sleeping baby. And our house can get really noisy, but I let that baby sleep right in the living room, in the kitchen, the dining room. We have a little chair that sits on the floor. And so the baby can be napping and be right where the commotion and the action is. Bumping into it, yes, the baby will wake up if you bump into it. So that's kind of one thing. I tuck the baby's little chair into a corner in one of the rooms so that way nobody accidentally bumps into him. However, noise, I don't limit that at all. The baby's used to the noises being inside my belly, and I don't want things to change just because he's born. Things might be a little louder, but that doesn't mean we need to be quiet. The baby will get used to it. So for this age, so he is six weeks now, 6.5 weeks, it's working fine. Now, as they get a little bit older, they'll become much more sensitive to the noise. So you will end up being a little bit quieter. But from the get-go, keep the noise level to normal. Tip number 4 is, and this is personal, this is for what works for our house, but the baby is your job. The baby is not your children's job. The baby is not your husband's job. The baby is your job, mama. And for women that may be working away from home, I don't know because I haven't experienced that, but for me who works from home on my farm, and for women who are not working from home, who are strictly raising their children, notice I did not say only raising their children, because stay-at-home moms do not get full credit. It is a full-time job staying home with our children. So for those of us who are going to be home, I firmly believe that it is our job to take on the responsibility of the baby. I do not pawn the responsibilities off onto my husband, because my husband leaves. He has to wake up by a certain time. He has to be present at his job. He can't be dealing with exhaustion and functioning the way that I can. If I need to postpone moving my cows a few hours, or even moving my cows a day or two because I am tired from the baby being up, it's okay. It's not a big deal. But for him, who has to report to a job and to people, he needs to be present. And so I do not expect him to wake up with the baby or to help me with any of the baby's needs unless I need the help. Now, that doesn't mean that dads and husbands shouldn't be there to support their wives. If the wives need help, they need to be able to step in, because I know that there's a lot of women that deal with postpartum depression, and that is something where they absolutely need the support of their family to help them. So I don't mean to downplay the importance of the husband. I just want to make sure that us women don't pawn our responsibilities off on our husbands just because we want it to be even. I know that I'm treading very carefully on that subject because that can be a very hot subject, but maybe you'd consider a little old school, and I believe that the women should be caring for the children exclusively, and the husbands are working away from the home most of the time and providing for the family. So I do not expect my husband to wake up in the middle of the night and change the baby and burp the baby and anything like that. That is my responsibility. Again, unless I am struggling and I need his help. And my husband never questions. He never makes me feel like I can't come to him at any time and ask for help. My next tip or piece of advice is to give yourself 2 years before you expect to bounce back. Our bodies have gone through a lot between being pregnant and then feeding a baby for however long you breastfeed. Now, obviously, the longer you breastfeed, the more time you're gonna need, and the shorter you breastfeed, the shorter length of time that you'll need. But your body is still trying to regulate hormones for quite a long time. And I remember it was several years before I could get out of a nursing bra and start wearing a regular bra again. So I think that we can be really hard on ourselves with this whole mentality that we should be able to bounce back. This should be no excuse for being fat and lazy. And I don't think that that's necessarily a gentle or realistic expectation. If your body has just undergone a huge task, be gracious with yourself. Now again, if you're eating processed foods and you're eating high levels of sugar, then that's definitely not doing your body any good. But for anybody who is just focusing on eating nourishing foods, whole foods, your body's not gonna have any issue regulating itself. My next tip is to make sure that your diet is full of lots of protein and lots of good carbohydrates and fats. You wanna be really careful about your sugars, like I just said, because that's not gonna do anything beneficial for your body. Your body is healing from the wound that it just had from the placenta being on it. You're also focusing on keeping your milk production. So if those are two things that are going on, then you're absolutely going to be needing to feed yourself high quality whole foods. One good method of eating that I have been doing recently has been the GAPS. And that stands for gut and psychology syndrome. And it basically is just a gut healing diet that helps with the gut and brain connection. And essentially we're cutting out grains, we're cutting out sugars, and so obviously any processed foods. And there are certain things that you eat more of and that you cut out. So you're eating a lot of broths, you're eating a lot of soups. I actually did a variation of this over the summer when I was pregnant because I was trying to make sure that my gut microbiome was good for the baby before he was born. So that's been something that I've been doing. I also, because of Theodore's gassiness and his colicky symptoms, I have had to cut out cheese and dairy. Now it seems like the little bit of milk that I've been putting in my coffee recently has not been bothering him. It's getting cold. And that, I believe, is because it's raw milk. It seems that heavy creams bother me, which I'm sure that seems to be bothering them. Anything pasteurized, though, seems to be bothering him. So I've been substituting a lot of the half and half and heavy creams in my coffee, which I do lattes, okay? I do a little bit of coffee with my milk. And I've been substituting that with coconut milk, which, I mean, it works, but I definitely can't say that I enjoy my coffees the way that I used to. And then I've also been trying to cut out any other foods that are known to give babies gas. So there's different fruits, there's different vegetables like green beans and beans, and I love green beans. They don't cause me any problems, but they definitely seem to be bothering him. Cauliflower and broccoli, 100% cannot eat them. So I've been eating a lot of high protein meals, lots of eggs and meats, lots of good fats. I've been eating some sweet potatoes, which are not on the GAPS protocol. However, I'm not really doing the GAPS protocol totally for gut health. I'm doing it for a combination of eating well, and it gives me guidelines that I know are good to have when I am breastfeeding and postpartum. So that's kind of what I've been doing, gaps with a little extra flair. And on that note as well, make sure that you're eating enough. I think that we're supposed to be eating close to 3,000 calories a day, which seems unbelievable. I mean, I could eat 3,000 calories a day if I was eating pizza, but that's the food that I'm trying to stay away from, especially with the cheese. So trying to eat 3,000 calories a day of heavy protein, animal proteins and fats, that can be a little tricky. And some ways that I've been finding to sneak extra calories in is by eating more consistently. So making sure that I have a breakfast and then a smoothie and then lunch and then a snack and then dinner, which can be a little exhausting because I feel like I've got lots of other things to do besides making myself food. But milk production is a priority to me, so I'm trying to eat as much as I can. And I'll do things like hide eggs in smoothies. I'll have, fried eggs or scrambled eggs for breakfast, and then in my smoothie, I'll crack a couple eggs in there. I've been experimenting with raw milk, but I do make homemade yogurt and kefir, and I put those in the smoothies. Those don't seem to be bothering him, I guess because they're fermented, they're cultured, they're not causing him the same kind of gas issues that other dairies are. So that's what I've been doing to try and increase my calories. And I'm eating a ton. At each sitting, I try and eat as much as I possibly can. Again, if milk production is a priority for you, then calorie deficit should not really be a priority. As much as it might seem that you're stuck in a place right now where you want to lose weight, it won't last long. You will be back. The baby will have weaned and you'll be ready to lose weight at another time. Don't focus on that right now. Focus on feeding and nourishing your baby. And my next tip then is also drinking lots of water. I have to force myself to drink enough water because I end up filling up on coffee and then find myself not being really thirsty, and I have to force myself to drink a cup of water as soon as I wake up before I have a cup of coffee, and then making sure that I drink water in between meals. And I literally will sit there and guzzle bottles of water just to force myself to drink. Another tip is have meals set up so that you can relax a little bit during your postpartum period. You should not be stressing out about having meals for your family. Whether your family is the type that will cook for you, like I have a couple teenage daughters that are very willing to help me in the kitchen. My husband, he'll do some cooking, but I can't really say that that's something that I would prefer to trust him with. I'd rather leave him with doing some of the outside work. But my older girls absolutely can help cook, and even my younger girls can do some small tasks. So I did have a ton of meals prepped and ready to go for this postpartum recovery period, which I did a video on. That allowed us to have meals. Oh my goodness, we still have a couple meals left over. We got kind of sick of the same meals on repeat. So those will just be for another busy day. I'll have meals ready for that. But it got us through several weeks. I think it was probably 4 or 5 weeks we did the meals that I prepared. So that was very helpful. If you don't have the energy or the time to prepare your own meals, then make sure that you have a plan in place either for friends or family members to bring some over for you. And if you're watching this and you're not the one that's recovering, but you know someone who is recovering, that is probably one of the biggest blessings that you can give them is food. And also by having your meals planned ahead of time, if that's the route that you're going, then you can also make sure that the food is a healthier alternative. I knew darn well that if I did not have meals prepared for my family, we'd be eating a lot of takeout. And I did not want to be relying on takeout. I mean, don't get me wrong, a cheesesteak every once in a while and a piece of pizza, well, like half a pizza, sure, that's great, but not for several days in a row, let alone several weeks. My next tip is outsource some of your work if you can. Now, I really struggle with outsourcing because I don't like asking for help. I don't really know why. I think it's probably because I built my life because that's what I want my life to be like, and it shouldn't be anybody else's responsibility to have to pick up my slack if I can't do it all myself. So it's nobody else's responsibility what I've decided to make of my life. However, I don't think very many people mind helping you during certain situations like recovering from having a baby. So whether it be outsourcing your laundry, like my mom had offered to take our laundry, I didn't take her up on it because, again, I have children that are able to help, and they all had a really good system down and were able to maintain laundry pretty good. There were a few days there that it got a little piled up, but that's okay. It got done. And then things like any of your other chores that you have. I know for me, with the farm, I had to recruit a lot of my kids to help with the animals and the farm work. Driving my children, that's actually one thing that my parents helped me out a lot with, is taking my kids to different functions that they need to go to. So transportation, so I was able truly to stay home for easily a month to 5 weeks. It was great. So outsource what you can. My next piece of advice is kind of a two-part piece. So on one hand, you want to be comfy and you don't want to feel obligated to have to wear clothes that are uncomfortable. For me, for example, I would much prefer to not put a pair of jeans on for several months. And I would much prefer to just hang out in sweatpants. But on the other hand, it was really refreshing to take a shower and, I mean, not that I didn't take showers, but what I'm saying is take a shower and put on nicer clothes like jeans and a sweater and do my makeup and put earrings on and kind of take a little extra step to shave my legs and my armpits, for example. Put some deodorant on. I did go a few days there without deodorant, and yeah, it was nice to get showered after that. So on one hand, get comfortable, and if that means not showering for a few days and just laying there in bed with your baby and just wallowing in your postpartum bliss, I mean, I don't think there's anything wrong with that. But on the other hand, if you're starting to feel really frumpy, sometimes the best thing that you can do is just get dressed, start smelling pretty, look a little bit more put together, and it's amazing how those two different things can really help. So just go back and forth between the two. My next tip is pay attention to your body. Are you bleeding? Are you cramping? Is your body sore and achy? Because that's the cues that you've been doing too much. And I know from just this time around, I did a lot of sitting in bed that first week, and I really should have been laying down more, and I felt it. I could feel the pressure and the cramping and the bleeding. As silly as that is, I definitely knew that I overdid it just by sitting on my butt for way too long. So lay down a little bit more. That first week, there's the 5-5-5 rule. 5 weeks in your bed. 5 days in your bed, 5 days on your bed, and 5 days around your bed. So how I interpret that is 5 days laying down, for the most part, within reason, 5 days sitting, and then 5 days, doing what you need to do around your bed. And I kind of did more of like 5 days on my bed, 5 days on my bed. So I did have to kind of go backwards, and I could tell when I started not feeling well again, I had to let everybody know, hey guys, I'm going to be back to being in my bed, which just means little things like, hey, I need you guys to hand me more things instead of me being able to get up and go do it. Now, at about 3 weeks, I want to say it was about 3 weeks, I fell down the steps and I busted my butt hard. And that really threw a wrench into my recovery because I feel like, I couldn't tell if it was pain from having a baby or if it was pain from falling down the steps and breaking my butt. So don't fall down the steps postpartum. But that's also my sense of judgment when I'm going out to start working around the farm. How am I feeling? So I started the store, I was about 5.5 weeks postpartum. Was that it? No, it might have been, I don't remember. It might have been 4. No, it was earlier than that. So maybe 3.5 to 4 weeks postpartum. Anyway, and I went out and I opened my store for the weekend, and I struggled with mastitis for a few days after that. I just feel like I was on my feet for several hours, and I guess I was just doing too much. It didn't feel like it was too much, but my body let me know it was too much because I had a lot of breast pain and a lot of mastitis symptoms. So I nipped that in the bud. So my next tip is dealing with mastitis. And I also kind of will lump this into overproduction as well, because I treated mastitis and overproduction pretty much the same way. I would very, very gently pump. Okay, so I dealt with overproduction for several of my babies. These last two actually were not bad at all. It's like my body's learned after, 5, 6 babies that it knows what it needs in order to feed my babies properly. So I didn't produce nearly as much milk as I did with the beginning babies. It was intense. And so for those babies, I would gently pump and just to express some of the milk for a little bit of relief. Now I know that that's kind of counterproductive because it also encourages milk production, but I promise you, get past the first 2 or 3 weeks and you'll notice that your body regulates itself pretty nicely. So I did very, very gently pump just to relieve myself. And then as my body regulated, I didn't have to pump anymore. Another thing that I did both for mastitis and for overproduction, okay, actually it was for mastitis, but what it did was cut back my production. And that is I applied cool cabbage leaves. I stuffed them around my breast in my bra, and that really helped tremendously. And then also bentonite clay. If you make bentonite clay up into a paste, and I added a little bit of peppermint essential oil in it, and I rubbed that around my breast, and that helped relieve, it helped draw out any inflammation, and it also does decrease your milk supply. So just be really careful. I did not do any of that this time around. This time around, when I started with the mastitis symptoms, I immediately took high doses of vitamin C, and I took homeopathic belladonna. And I just nursed the baby on those sides. It was actually one side one day, and then 2 days later it was the other side. So I ended up nursing the baby on that side and just massaging and just trying to really help with any heat, just helping to massage it and bring down any inflammation. My husband and I joke around because I had an udder mastitis, like a cow udder cream. He's like, oh, is that for you or is that for Daisy? So, I mean, the same thing for cow mastitis works for human mastitis, with peppermint creams and clays and aloe veras. So I should just get that mastitis cream that I made for my cow. I think it had clay, peppermint oil, rosemary, was it? Eucalyptus, On Guard. Did I say aloe vera? Apple cider vinegar? I feel like I've repeated myself. And I just made this mixture of all of it, and it was wonderful. So you can apply that to yourself as well. I know that one huge factor to look out for when you're dealing with mastitis is a fever. And that's one thing that I kind of paid real close attention to. If you're getting a fever, then I wouldn't mess around with that, and I would reach out to your midwife or your doctor. I don't personally take antibiotics. I've not needed to, like over-the-counter antibiotics, but I do take colloidal silver. I do take oregano oil and grapefruit seed extract. So there's several different things that I can do that are like a alternative to antibiotics that have given me no problems. I've not had to seek out regular over-the-counter antibiotics just from using those. Another piece of advice is sometimes you need to be surrounded by people. You need the stimulation, you need the companionship, you need the interaction and entertainment, and other times you may find yourself preferring to be left alone. And so I think just knowing that, don't be afraid to ask for what you need, whether it be people to be around or whether it be personal space. I always thought, and most people think, oh, after you have the baby, you just kind of want to be left alone, you don't want any visitors. And though going into it, I felt that way, but after the fact, I was actually really, really excited to be able to have visitors. I was excited for my neighbors and my friends and my family to be able to come over and visit and see the baby. I had just been through something really huge and now have this precious little baby in my arms, and I wanted to be able to see people. I wanted to show my little newborn baby off. But sometimes you also kind of need to hide back and just take some time to bond in quiet and seclusion. And I've had that experience as well. So just make sure that you are paying attention to what you think that you might need. Another piece of advice is to make sure that you have a support system in place, whether it be your husband, who I would hope that that would be the case, but it could also be your children or your family or friends. You need someone that you can talk to when your hormones start making you go crazy. And I will tell you, I have not suffered from postpartum depression other than just a few moments where I could tell that I wasn't right. And those moments I reached out to my husband and I just said, I really just need help right now. And so make sure that you have a support system in place, because postpartum depression can get really, really ugly. And having a team in place, again, your family, your friends, someone in place that can be there to support you is crucial, So one thing I got a lot of heat on was in my video, the fact that I chose to take a decent amount of time and stay in bed with my baby and to stay a little bit isolated from everybody and everything. And I'm actually really surprised at the two totally different viewpoints. I had a lot of people that were really upset with me that I would do that. It kind of got a little nasty. And then on the other hand, I had a lot of people that were very supportive, were very encouraging that, yes, mama, you're doing the right thing by taking that time to be with your baby. And I'll just say this one thing, whether you're the type of person that can get up and go shopping the next day after having your baby, or whether you're the type of person that needs to recover for 6 weeks in bed, I know for me personally, after having 11 miscarriages, wanted nothing more than to just let all of the world fall away and just disappear. And I just wanted to be with my baby and to hug and to snuggle and to love on my baby. I would say that after things like that, after miscarriages, after loss, after infertility, your priorities and your perspective changes significantly. And I know for my case, it definitely did, because I didn't care what was going on around me. I just wanted that baby on me and snuggled, and that is the only thing that mattered at that point. So before you go and judge and get nasty with people, just remember, everybody comes from a different place and we all have different perspectives on the case. However, I strongly encourage that you take a solid 6 weeks to recover before you even start thinking about doing anything other than just being a mom to your new baby. Another little trick that I actually just learned about with this last baby was burping. So I'm going to show you a little clip right here on the proper way to burp a baby. You hold your hands underneath the chin and you rest your middle finger and your thumb right on either side of the cheekbones, right around the ear, heading up the face, and rest their little chin in that little crook of your hand. And then you hold their little bum in your other hand and you just wiggle that baby back and forth and move them around. And then you straighten the baby's spine if you have to. And I will tell you, that has been the most successful method of burping I have ever done. And I can't believe after all these babies, I've never done this method before, but it worked every time. So I just thought that was a cool little trick that I'm glad that I found out about. So I want to be able to share it with you. All right, so I also wanted to share with you a few little things that I have for this baby, and I will show them to you individually one at a time. Baby clothes. As much as we want adorable little baby clothes, I just have to make sure it doesn't have stains. My little newborns lived in these gowns. You can just roll the little gown up, access the baby's diaper, and voila, simple. My next favorite, and actually now that he's getting a little bit more mobile and moving around a little bit more, these are my next favorite. I've been using these a lot more. And these are little footed onesies. Some of them are really sweet and they've got 2 zippers down here, so you can zipper it from the bottom and pull the diaper, like get to the diaper without having to, hang on baby, without having to unzipper the whole thing. Yes.
The ear is awake.
Oh, he's awake? Okay,
Yeah.
That's okay. It's okay if he's awake. Just don't bother him, okay? So these are my next little sweet outfits. I do not do individual shirts and pants if I can help it, because they're just so annoying. And all the cute little outfits. I did get him a couple cute little outfits for the holidays, but that is it. My children wear these, hang on love, wear these for the first, probably 9 months of their lives. Actually, once they start walking, then I will move to the footless ones so that way they can get a good grip. But if they're not walking, they're in these little guys. My next wonderful little doodad is a muslin, I guess like a gauze little blanket. Now, I don't remember these being a thing for my first couple babies, because I would think that I would have found them, but I was gifted some of these blankets for one of my babies, and they're amazing. They're this gauze material. I know you know what they are. And they're absorbent, so the baby burps on them, it soaks it right up, whereas like the little cotton receiving blankets, I think they're called, the throw up will just roll right off of it. And these are big enough that I use them as a nursing cover so I can nurse the baby. They're wonderful. I actually had a really cute pattern on one, and this one I might do as well. And I made an apron out of it. It was so big, I was able to just tie it around my waist. Hang on, honey. I was able to just tie it around my waist, and it was really nice as an apron. So I think this one might be my future apron. All right, another item that we used, golden seal root. There we go. So this is just a powder that I open the capsule and I just sprinkle a little bit of powder on the umbilical cord, and it helps the umbilical cord dry up really nicely. So these are all just random things that I use in no particular order. Calansanya root. So Calansanya root I used for a couple things. I just had this weird feeling when I first got pregnant and knew that I very likely could miscarry. I just had this really weird gut feeling that maybe this would actually help this baby. I don't know. It helps with blood. It helps with, it says supports vascular tissue and water balance. And so I took this, and he happened to be a sticky baby. I don't know why, but I just wonder if this has something to do with it. So Calansanya root, that I took that. Where I'm getting with this is also excellent for hemorrhoids. And I know that we don't really want to talk about this private thing, but hemorrhoids is a bear after you have a baby. I think that having the baby was one thing. Hemorrhoids was the biggest pain in my butt. It made recovery so awful. That was the most painful part of recovery, was the hemorrhoids that would just never go away. Okay, so this time around, I took Calansanya root pretty much most of my pregnancy, but really consistently the month leading up to me having him. And since he was 2 weeks late, technically it was a month and a half leading up to him. And I'm telling you, no issues with hemorrhoids this time around. I'm just gonna say, there was no pain. I don't know. I didn't go looking all there, but no pain. So I wish that I would have known about this all those babies ago, because it would have saved me a lot of tears. Next little tidbit is Lansino cream. If you're a breastfeeding mama, you're familiar with this. This is lanolin, and you just put a little tiny drop of lanolin right on your nipples, and it helps to keep them from getting chapped and cracked and bleeding. And I will tell you, when you have a little sucker fish on you all the time, ooh, they get chapped. So this has been a game changer. The next thing is After Ease. I have taken After Ease for all but my first baby, because my midwife introduced me to After Ease. It is a nasty piece of tincture. It's no yummy. It's no yummy at all. But I, with my first baby, would take 800 milligrams of ibuprofen around the clock. I mean, this is for after cramping. I'm sorry, I was not specific with what this was for. After you have the baby, your uterus, which was big enough to hold a baby, now shrinks down back down to normal size, which I think is like the size of a grapefruit or your fist or something like that. I don't know. So after you have the baby, I am almost convinced that the after cramping that lasts for about 2 weeks, a week and a half, that is almost more painful than regular contractions. I will tell you, it is more painful than regular contractions. The only thing that is more painful than your afterbirth contractions is when you are transitioning. I would push a baby out a million times before having to deal with 2 weeks of afterbirth uterine contractions. However, this stuff was a game changer, and completely, as long as you keep taking it. I mean, I took it like juice, okay? I took this around the clock every couple hours, and it was amazing. I also, I mean, I used half the bottle for this baby, for this postpartum. This is not for babies. So let me just clarify. This is for mama. I used about half this bottle, and I am keeping it because for when I get my period back again, this helps amazingly with menstrual cramps. So I give this to my teen daughters as well. Another thing that really helped with the uterine contractions was belly binding. And basically what it is a very, very long piece of fabric that you wrap around your belly in a particular way, and it helps bring everything back together again. It helps to bring your waist and your abs and your uterus all back in, and that definitely helped with uterine contractions. That, and also having something heavy on my stomach. So when I was laying in bed and I was laying flat on my back, I had heated lay pads that the weight of those pads helped to push down on my uterus. So that weight and that pressure, I don't know if it just helped the uterus not have to work so hard to contract back down, but having pressure on your stomach absolutely helped with the uterine contractions. And also heat. The heating pads were a huge part of just getting that relief. I would have the heating pads on my stomach and the weight of the heating pads, and then I also would rub my hands down my thighs just to help with the contractions and the pain. So that helped tremendously. Next thing on the list is liquid vitamin K. Vitamin K you can give to your baby as an injection, which I'm pretty certain I did the first baby because I had her in the hospital, and vitamin K injection, no big deal. Well, I did more research, and I'm telling you, I would never give my baby a vitamin K shot after doing the research. So, and I don't even know, honestly, I was a little hesitant to even give this oral drop as well because I was kind of wondering if they even needed it. But I did give the babies vitamin K orally in this drop, and you just give them a couple drops every week. It's not a big deal. It's not invasive or anything like that. All right, real quick, because baby's crying and I've got another one upstairs needing me to wipe her butt. So because Theodore and all of my babies had colic, one thing that I had done since the beginning is liquid infant probiotics. I give this to my baby. It helps them poop, especially being a breastfed baby. Sometimes they'll poop every day. Sometimes they'll poop every couple days. You just never know. So this helps the baby's digestion and with colic. I also got these Highland homeopathic colic tablets. And I give these to my babies a lot. I mean, I think you can give it every 15 minutes for so many doses, for up to 8 doses, and then every 2 hours is required. I will give my baby a couple doses of this every 15 minutes, and that usually is enough. So this is a huge help. The other thing that I did, when I knew that I was having dairy, I would take Terrazyme. It's doTERRA's digestive enzyme. So I am a lover of doTERRA products. You don't have to if you don't want to. I know this can be a little rub people the wrong way. But I take their digestive enzymes, which are a game changer, and also their DigestZen, which is the essential oil blend to help with digestion. Both of these I take pretty much, I mean, what they say on the bottle, how much to take. I love them. They have helped me tremendously. I will tell you, I don't have dairy because I still notice it bothers him, but when I take digestive enzymes, it significantly helps the colicking. So that's what I take. And also, last but not least, when my baby is dealing with a stuffy nose and congestion, I use my Breathe essential oil, which has laurel, eucalyptus, peppermint, tea tree, lemon, cardamom, Ravinsara. And so this is a whole blend of essential oils to help open up their respiratory path, because they, I don't want to give any of my babies any medications, and it's really hard. You can't blow a nose. So I will put a little bit on their clothing, not on the skin, on the clothing. Just the way the baby gets to breathe it in a little bit. It wears off fairly quickly, so it's not something you have to worry about the baby breathing a ton in. So this is what I use. I also have one of those blue little snot bulbs, and I'll use that and I'll, suck the snot out. It sometimes works, sometimes doesn't. The other thing that you can do is hold your baby in the shower with you while you put a little bit of essential oils on the shower floor, and then that steam will really help the baby with loosening up their snot as well. All right, we're back. We had a little one wake up from a nap. Oh no, look at his crazy hair. Okay, Theodore, okay. Okay, so I'm gonna wrap this up real quick because I am not gonna be given any more time. So I hope that was encouraging. I know that these aren't your typical, must-haves with a baby, but they're my must-haves. And I'm sure there are other things that I am not thinking of, that if they come up, I will make sure to put them in the comments so that way any other tips that I might have. Please feel free to ask any questions if any of this was confusing, or if this brought on another question that you might have, but I hope this was helpful. All right, so that's all he wanted was a boob. You've got this, mama. You've totally got this. You're learning. Don't be afraid to ask for help and ask for advice. And there's lots of different opinions and lots of different input that people will give you. And I can't really say that there's anything that's right or wrong. It's just people's experiences. So you'll learn and you will gain experience. Oh, we're choking. So I hope that this was helpful for you, and I hope that you have a wonderful week. Okay, so I love repeating myself nicely a million times. So,
and I'm under the table.